So I'm here. My guest is our founder and director of the ECA Wellness Center of Rhode Island. He's conducting medical research on COVID long hauler syndrome. He's part of a group treating over 5,000 patients with long hauler symptoms. And I'm part of that clinical research, and we're glad to have him, Dr. Ram Yogendra. Oh, wait a minute. I said it wrong. His name is Dr. Ram Yogendra. There it is, right? I got it right? Thank you for being here. And I just wanted to run something past you. So having SARS-CoV-2 once confers much greater immunity than the vaccine. So if you actually get the virus and you weather it and get better, you have greater immunity going forward than you do if you get a vaccine. Is that true?
Yes, I mean that's one of the staples of medicine is natural immunity. It's in our immunology textbooks. We learn in undergraduate and graduate school and medical school and so forth. So it makes a lot of sense. What we don't know is the amount of antibodies, like the titers, what confers protection. So I think that there's a confusion there because sometimes we think, okay, natural immunity is going to protect, but it varies. The amount of titers varies from your response from the initial infection. What we don't know is what that level is. And I think that's where this kind of gray area is. It's like, should we give 1 dose of vaccine? Should we give 2 doses of the vaccine? Or should we not give the vaccine? And I think that's why there's this mixed messaging. And I think here's the thing, Jimmy, we don't know. And I think we should be open with the people and the public and say, look, we don't really know. And some of these mandates just don't make a lot of sense. They're not grounded in science. These 2 vaccines, for someone with COVID that has natural immunity, I think it's reasonable to say, get 1 shot, where their infection is considered 1 shot, and let them get a 2nd shot. Or let them get 1 shot, so that would be considered 2. Instead, we got these vaccine cards now. You got to have the signature Pfizer on 2 spots, or Moderna on 2 spots, or Johnson & Johnson on 2 spots. If you have 1 and you've already had COVID, they're going to say you're not fully vaccinated, and it doesn't make any sense. And there's something called hybrid immunity. So hybrid immunity is when you have natural infection. And then you've also got, natural antibodies or antibodies from natural infection. And you also got antibodies from the vaccine. So you got a combination of both. And there's some studies that have shown that maybe that actually confers greater immunity than just the vaccine alone or just natural antibodies from natural infection or natural immunity. So you're seeing a lot of conflicting, you're seeing one study says this, some other report says this, and now everyone's going, what do we do? But I do not think that the vaccine mandate that everyone gets 2 jabs, quite frankly, is not grounded in science at all.
Wow. All right. So we're going to get to that right next. But here is this question being posed to Dr. Fauci by Sanjay Gupta on CNN about this, about people having greater immunity from having COVID than they get from the vaccine. And so a lot of people are saying, why should I be mandated to get a vaccine if I already have greater immunity than the vaccine will give me anyway from COVID? So here's that question being posed to Fauci, and his answer is very revealing.
There was a study that came out of Israel about natural immunity, and basically the headline was that natural immunity provides a lot of protection, even better than the vaccines alone. What are people to make of that? So as we talk about vaccine mandates, I get calls all the time. People say, I've already had COVID, I'm protected, and now the study says maybe even more protected than the vaccine alone. Should they also get the vaccine? How do you make the case to them?
You know, that's a really good point, Sanjay. I don't have a really firm answer for you on that.
So there you go. That's the top guy. Doesn't have a firm answer on people who have natural immunity being better than the vaccine immunity. And so, again, this kind of BS answers that we're getting from people like that about questions that seem to have their own answer. If I get greater immunity from COVID than a vaccine, how in the F can you mandate? Well, here's the president right now. This is before, this was last year. This is what he was saying. This was in December. So somebody asked him, do you think the vaccine should be mandatory? And this is when he was president-elect last December, and this is what he says.
Well, I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power, just like I don't think masks have to be made mandatory nationwide.
He said no, he didn't. And when he was president-elect, he didn't think vaccines should be made mandatory. He didn't even think masks should be made mandatory. That's when he was president-elect in December of 2020. But now he says sweeping new vaccine mandates for 100 million Americans. And there's a lot of unintended consequences. So let me just show the unintended consequences of this. And Chicago school bus drivers have quit in droves over COVID vaccine mandate. Chicago public schools lost 10% of their school bus drivers quit on Friday as they're unwilling to get mandated vaccines. This district is now offering cash to parents who drive their kids to school, and a lot of those parents don't have cars to drive their kids to school, so they have to get Ubers. And do you think those Uber drivers are vaccinated? No one's checking, I'll tell you that. Here's police unions across the country look to stop the mandatory vaccination among officers. That's nationwide. Cops don't want to be mandated to take it. Okay. LAPD officers sue the city over the COVID-19 vaccination requirement. Look at that. Look what's so the people the people enforcing a vaccine mandate are not going to be vaccinating mandates them. They're not being mandated to take a vaccine themselves. How does that work? How does a cop come up to me who's not vaccinated and arrest me or give me a ticket or a fine for not having my vaccine? That just seems kind of crazy. Biden's new vaccine mandate is hardly a mandate if you also get the option of testing once a week for the virus, which you do. Anybody who isn't telling you that is being dishonest. First of all, this is kind of funny because he says Biden's new vaccine mandate is hardly a mandate. If you could do this other thing, that's also a mandate. So you either do this mandate or you do the other mandate. They're both mandates. But Biden to mandate COVID vaccine for federal workers, removing the option to get tested. So that's not true. So this was a ridiculous tweet. Got 8,000 likes because misinformation gets a lot of likes around COVID right now and the treatment of it. So anybody who's telling you this is being dishonest. So isn't it ironic that what he's saying isn't true because Biden COVID vaccine he removed the option to get tested instead. That's according to CNBC. Thursday's order will remove the option for rigorous testing as the United States struggles. So that's gone. Guess who else doesn't have to vet? Members of Congress and their staff are exempt from Biden. Do you really think that school bus drivers are going to be held to a higher standard than Congress when it comes to vaccine mandates? By this way, and those are blue collar workers are the ones being affected by this the most, of course. Joe Biden, COVID vaccinations in U.S. will not. So that's when he said that. And then here's Nancy Pelosi saying the same thing last year. What?
So here's the thing. We cannot require someone to be vaccinated. That's just not what we can do. It is a matter of privacy to know who is or who isn't.
So would you respond to this vaccine mandate? So Nancy Pelosi, Joe Biden, completely contradicting themselves just a few months later. And lots of people, the Congress isn't mandated for it. The people who are passing it, they're not, and cops are supposed to be enforcing it. They're not mandated. So could you speak to this, please?
Yeah, Jimmy, I think it's this mentality of we're going to get to zero COVID, right? You get the vaccine, you're never going to get you're never going to get an infection. That's what was told to us. And we're going to get to zero COVID. That is never going to happen. COVID is going to be here for the rest of for eternity, at least most of our lifetime. It's going to be like the flu. We might have to take like a flu shot, an annual flu shot. Maybe we have to take an annual COVID shot. I think these mandates it's going to come bite a lot of them in the rear end in a couple of months. Because you're seeing patients, it's being talked about or sold to us as it's going to prevent you from getting COVID. No, it's going to mitigate the risk of you getting severe COVID. That's really what the vaccines are doing. And that is what the data is showing. It's preventing people from going into the hospitals. I actually have a friend of mine fully vaccinated. She was on a set in Texas. Now she's in LA, most likely going to be testing positive for COVID. She's got all the signs and symptoms that everyone on this set was testing positive left and right. She's fully vaccinated. So now she's asking me, but I got the vaccine. How did I get this? Well, we knew all along, it was going to mitigate risk if you did get COVID. So these mandates they just don't, quite frankly, make any sense to me, because mandating is not going to move the needle. Sure, you're going to have some people having to take the vaccine for their job, but you're also going to have a lot of disgruntled, angry people, and they're going to get even more angrier when 6 months from now they're going to be told that, oh, you got to get more vaccines because the antibodies that you got were either not effective or you don't have them anymore. So it's like we're plugging holes in the ship, and we have no idea where the water is coming from, and we're just randomly scrambling around, just making up things that, quite frankly, don't make any sense. I think, again, it goes back to transparency. It goes back to transparency and openness with the public on what we know and what we don't know. I think that's the challenge. That's the most difficult thing, Jimmy, is like, why don't we tell people we don't know? What's the harm in saying that? Be honest. I think there'll be more people, there'll be more buy-in if we were honest with people.
Yeah, so what raises people's level of trust is when the government is honest about what's happening. And even if they did a study in, I think, Denmark, and they found out that if you tell people the truth about the vaccine, their inclination to get it might lower a little, but their trust in you raises immensely. And that's the important thing. You need to build trust between the medical community and the people, and they're not doing that. So Brian Seltzer tweeted this out from CNN. He said, an unvaccinated minority that doesn't watch the news or trust the news, I wonder why we just showed them lying and stating the wrong science, medical misinformation constantly. We just show why. I wonder why, Brian. He's the media critic. He has no idea why nobody trusts CNN. An unvaccinated minority that doesn't watch the news or trust the news is putting the vaccinated... By the way, that's... the majority of people don't trust the news. Just let's get that straight. The overwhelming majority of people don't trust the news. And they're putting the vaccinated majority at undue risk. There's no way around that reality. Now, please explain to me. First of all, he got racial crazy on that. But let me ask you this question. If I'm vaccinated, what kind of threat does an unvaccinated person pose to me? Because we now know, doctor, that vaccinated people can shed the virus just as much as unvaccinated people, correct? So if I'm standing next to a person who's vaccinated and a person who's unvaccinated, I have no idea of knowing which one is shedding virus. They could both be shedding, one could be shedding, or neither could be shedding, and I don't know which one is, right? Isn't that correct?
Absolutely, Jimmy. The other thing, too, when you see these things about the unvaccinated minority, you're literally talking about almost 48% of the United States is unvaccinated right now. Like 52% of America, the last numbers this morning, 52% are vaccinated. So you have 48% of the country is not vaccinated. I mean, that is not when you see tweets like this, it makes it seem like it's a small group of uneducated people working on farms or, out of the urban areas. That's not true. The number of actually PhD researchers, physicians that have actually told me that they're not vaccinated is pretty shocking. You'll be surprised at some of the major institutions. PhD researchers are not vaccinated. I was pretty shocked about that. And that's also been, I think there's been some reports about that PhDs have one of the highest numbers of unvaccinated because they have concerns and they are worried about some of the safety issues and all these other things that we've been talking about. But, to frame it this way, it's very divisive. It's not helpful public health messaging. Being cohesive towards coercion towards someone, forcing them, mandates. Well, people don't react to that well. They're going to react very negatively to those things. So the stuff like this is not very helpful. And the other thing too is when I'm vaccinated, I'm part of, if you want to call it, the herd immunity. And I'm also including the natural immunity groups of people there too. And so what we're doing is we are mitigating the severity of the illness for me to get it, and also we are also just protecting each other, even the unvaccinated, to the herd immunities. When most of us are, when we have the antibodies from both the vaccine and the natural immunity, we're cutting the number of that transmission and the number of the people getting really sick. So stuff like this is just it's not helpful at all. But I think this is also the root of the problem. This is the root of the problem. And here's the other point, Jimmy, I want to make about this whole thing. We're so focused on this vaccine thing, and rightfully so in this discussion. But here's the other major thing that we don't talk about: therapeutics. Breakthrough infections are going to take place, no doubt. And what do we have for that? We've got monoclonal antibodies, but try getting that in the LA area. Right now, I'm trying to get that for a friend of mine. Fully vaxxed, and she's most likely got COVID. I'm trying to find a monoclonal antibodies infusion center for her. It's difficult getting access to it. We don't have any really effective therapeutics. Ivermectin, maybe. Remdesivir is garbage. What else do we have? So I think in order to really combat COVID-19, get this pandemic under control, is a combination of getting more vaccine platforms, effective vaccines, and therapeutics. And I think the therapeutic part is the one that's missing in our discussion. We don't have any medication. You go to a hospital, it's really not going to do anything for you. So I just think that the discussion needs to be also focused on the therapeutics and why we have not focused it. There's a couple of new experimental drugs in the pipeline. The question is, are they going to be better than ivermectin? And we don't know. In fact, Merck has a drug called molnupiravir, which some like Dr. Corey and others have been insinuating that maybe they are trying to, because ivermectin is cheap, it's generic, there's not a lot of money to be made on ivermectin, that there might be some nefarious reasons to suppress ivermectin to push this new drug called molnupiravir. I believe it's in a phase 3 clinical trial. Interestingly enough, it has almost the same mechanism of action like remdesivir.
No kidding. No kidding. Well, I thought this was my guess was that the big pharma was going to invent a new medicine based on ivermectin's chemical makeup, and then just tweak it a little so they could say it was different, and they could get a patent on it, and then that's when we all get to take it. That's my theory. We'll see if that's what it's going to roll out. So let me just get back to this one more time, what this Brian Seltzer says, because I've had one of my writers and I have been talking about this, trying to get to the bottom of this. He says that if you're unvaccinated, you can shed the virus for twice as long as someone who is. So if you're an asymptomatic carrier of the virus, you can give it to someone else longer if you're unvaccinated than if you're vaccinated. So you only can shed the virus for a few days if you're vaccinated, but if you're unvaccinated, you could shed it for like a week. Is that true? And does that make sense to see? Because to me, I just go, well, if I'm standing next to a person who's vaccinated and a person who's unvaccinated, you have no idea at any given moment which one of these people are shedding, and they both could be. So go right. So you, Timmy, what you say to that?
To be honest with you, Jimmy, I haven't seen really any studies to say like being vaccinated is going to allow you to shed the virus in sort of a less period of time. But it does make sense that I think it would probably be the same amount. I haven't seen any studies to really support that, because you're saying you can have the virus in your nasopharynx and your nares, and you could still be, passing on the virus for days, even if you're vaccinated. What the vaccine does is that if you get an infection, a breakthrough infection, in my opinion, it's just mitigating the risk. You're not, if you look at the statistics right now, it's keeping people out of the ER. They're not keeping them out of the hospital, keeping them out of the ICU. That's really clear. But again, we're starting to get some cases where the vaccinated are ending up in the ICUs now and they are getting hospitalized. And the concern for me is we don't have any medications for that. And this whole mentality of vaccine, Well, how are you going to help those patients in the hospital now? They got the vaccine. They did what they were supposed to do. They got the 2 jabs. Now they're in the hospital. And now you've taken ivermectin away. Remdesivir is garbage. What do we have? Steroids? A ventilator? God?
So does fluvoxamine help after you're sick?
Yeah, it's interesting. So WashU did a study put out in last October that actually has the anti-inflammatory properties that worked on inactive COVID. And interestingly, there's a big study called the Together trial. They just put the interim data out about 2 weeks ago. According to that study, ivermectin was not effective, but fluvoxamine was better. And you know what's interesting? What drugs? I have some friends that are managing active COVID right now. Statins, fluvoxamine, and an HIV medication called Maravirac. And all 3 of them, we're using combinations of that on long haulers and on post-vaccine patients too. So we're sort of like focused on researching this on this group, and now we're kind of going, all right, let's use it on the active COVID. And we're getting some real interesting reports from doctors around the country. Another drug is called fenofibrate. It's also known as Trichlor. It's an it's used for cholesterol. A lot of people are on fibrates. Penn Medicine's actually doing a clinical trial using it on active COVID. There's some interesting signals. There's a couple of internists that I know and intensivists that are using fenofibrate. And patients are doing, their outcomes have been pretty well. And I think also we shouldn't discount the role of vascular inflammation. We're so focused on the respiratory parts of COVID. I mean, that is how the virus enters us. But there's a vascular component here that I think, if you're looking at some of these early interventions, patients that get heparin or some of these other anticoagulants, they actually tend to do a lot better than patients who did not receive any anticoagulants. And again, we're seeing that with post-COVID cases, and we're seeing that with post-vaccination cases. It's a vascular disease, and some of these patients are doing well with anticoagulants.
Okay, so a lot of misinformation out there. You can't trust them. Establishment media, obviously. We covered that Rolling Stone garbage that went around the world. Lie gets around the world before the truth gets a chance to put its pants on. And everybody reported that ridiculous story. I'm sure you're familiar with it, that in Oklahoma, there was an emergency room that was overflowing with people taking ivermectin overdoses, and they couldn't even treat gunshot victims. And that was a completely made up story. And Rachel Maddow's tweet about that is still up. So that was reported ubiquitously from Rolling Stone. It originated at Rolling Stone, and then every news outlet, including in Canada, reported that. So you can understand why 48% of the country is still hesitant, because they don't trust people, and you can understand why they don't trust people. I certainly understand why they don't trust people. Is there anything I didn't ask you think I should, or that you wanted to say before we say goodbye?
Well, Jimmy, I think we covered it, and thank you for giving an opportunity to come talk with you. I've just been a big fan of your show for even way before COVID. I think it's really important that public health officials and doctors, we are open and honest and not afraid to say we don't know. I think that is, I think even when you're talking about allopathic medicine, talking to patients, I think they appreciate when we say we don't know rather than making up stories, because people are not stupid. And I think that, when you hear some of the way that health officials have talked during this pandemic, it's almost like they talk down and they think that we're stupid. And the general public is not. These are very intelligent, smart people. And what I've come to realize is that there's a lack of trust now in our medical system. I've dealt with, like I said, personally, people with about 150 cases where I didn't even know who these people were, that called me from all over the country, wanting to get experimental medications, wanting to educate their doctors about some of these things and therapeutics out there. It was shocking how very little, the medical community really knew. They would ask me, how do you know about this? Are you being paid by these pharmaceutical companies? I go, no, I just went on Google. I have friends of mine that were literally dying of COVID, and I was trying to save their lives. And all I did was a PubMed and a Google search, and you can do it too. It's not rocket science. So part of it, what what I think is really important is we have to continue getting information out there to doctors and our public health officials. You'd be surprised how many doctors don't know about Novavax. I tell them all the time, and they go, "Oh, how do you know that?" Google.
I know about Novavax. I know about
Jimmy,
it.
you know what's really, I remember in February, another one of my colleagues in the hospital, I told him about ivermectin. He was, what exactly is that? So he's writing it down because one of his family members had got COVID. I'm like, some doctors are treating with this ivermectin drug. He had no idea. He goes, so unfortunately, a lot of in the medical community, they're getting their news from CNN. They're getting their news from Rolling Stone. The number of my doctor friends were texting me, and they have nothing. They have no idea what I've been doing. Hey, isn't this horse drug that you've been talking about? Look at Rolling Stone said. I go, Jimmy, I've worked in trauma. I trained in inner city New York. I did trauma. If you get a gunshot wound, if you get a knife or a motor vehicle accident, you are going to get in the triage center. You are going to get prioritized. So the moment, a lot of us saw that report from Oklahoma, the gunshot victims are being turned away. That does not occur anywhere in the United States. We do not practice medicine that way. If you have if you have an overdose, you will get triaged to one side. The nurse will do whatever, put an IV, give you fluids, they'll monitor you, and all hands on deck with the trauma case. We don't say, oh my God, an overdose, and have 30 people around that bed going, they took a horse dewormer, this horrible person, I'm going to tell Rolling Stones. It doesn't work that way. And, a lot of these tiny rural hospitals, too, they don't have the capability of seeing a gunshot wound. Most of them go to big tertiary centers that actually have a dedicated trauma unit. This team does not do anything except trauma. I know because I worked in one. I trained in New York City. We were just a dedicated team. We didn't do anything else except when GSWs, which are gunshot, knife wounds, motor vehicle accidents, so these big gangbangers would come in. That's all we were. You could have a broken toe. You could have gotten into a fight with someone. We don't care. We got a dedicated team for that. So to hear these things, it's like we just roll our eyes. But how do you, when these things go viral, and then I'm getting these messages from my doctor friends going, hey, it's the horse paste thing, and you're not only fighting disinformation and misinformation, you're having to go up against these physicians that are just skeptical, and they're just buying into this and pushing this over. And the problem is that you lose the trust of the American people. You lose the trust of the public health. So whenever we do have something important to say, yes, the vaccines are working, there are some side effects, people are going, no, I don't believe that. Let me know more. What else are you hiding from me? Because everyone is skeptical, and you're not convincing them. It's like they don't, when you, and the example you made about the trust thing, I talk to the patients about it. I tell them about when it comes to the vaccine. Look, I think it's relatively safe, at least what we know so far. It might give you protection, but you have to make that informed decision. I am actually not someone that's going to push that towards you, because I do know patients that have gotten the vaccine and have gotten severely injured. I know long COVID patients who are debilitated from the vaccine, and I got people that are afraid of taking it. And if I tell them to take the vaccine and they get injured, I've given them wrong advice. But if I tell them not to take the vaccine and they get COVID and they end up in the ICU, I've also given them wrong advice. So I frame it that way. And I say it's risk versus benefit. And it's something that you need to speak to your physician about and see what is the risk that you want to take, which is why I think these mandates are so harmful, because we're not taking an individual approach, and we need to understand every person has a different situation. We can't just say vaccines for everyone, because what's going to happen is people are going to resent, get angry, they're going to lose their jobs, and how are we going to properly, effectively communicate a public health message when you have half the country that doesn't trust you?
Right.
You're not.
You're 100%. Hey, everybody, we just added stand-up dates in Florida and Arizona. And we are going to be at Harlow's. We just added a second show in Sacramento, California on October 3rd. 3rd. Is it the 3rd? I think so. So go to jimmydorcomedy.com for the Florida tickets, the Tempe tickets, and the Sacramento, California. See you there.